Hi there. We'll go ahead and get started. Thank you for joining us today for our VXV Mental Health webinar series. Today, we're going to talk about the landscape of digital mental health and kind of the key pieces out there in the landscape and where you can start in terms of identifying digital mental health tools and evaluating them as well. There we go. So I am one of the presenters today. My name is Dr. Chloe Nicksic Sigmon. I am a psychologist by training, and I am the director of research at VXV Mental Health, which means that I oversee a lot of our implementation efforts and real world or clinical trials and all the research related work that we do. And Debbie, I'll go ahead and let you introduce yourself as well.
Good morning, everyone. Thank you for joining us this morning. My name is Dr. Debbie Boeldt, and like Chloe, I am a psychologist by training. I've been working in the digital health field generally for the past decade or so. Here at VXV, we focus on a lot of different things, which I'm going to go over in a second here. But in terms of my role here, we look at a lot of partnerships and ways to collaborate with the community, with tech companies, investors, and healthcare providers. So with that, Chloe, if you want to go to the next slide, VXV is focused on bringing all of these groups together into an ecosystem that provides a way for us to deploy and develop digital mental health in a way that is effective and fast. We understand that a lot of people are trying to leverage these tools, and reinventing the wheel each time can be really arduous and difficult. And so our team tries to streamline this process. You can think of us as an extension of your team. We are a team, as you can see here, of psychologists, but also masters in public health, business, and whatnot. And so we bring together a lot of different aspects to digital mental health for your organizations. And then specifically on this next slide, this is a very detailed slide, but it outlines a lot of different ways that we work with different groups. As you can see, we can help around diligence and identifying technologies, but also understanding the needs of your organization and bringing in the correct technology that's evidence-informed and evidence-based. We do a lot of work around focus groups and research strategy, and then really the area that we've spent a lot of time in the past several years is around deployment and implementation. So how do you successfully bring in technology? We know there's a lot of great tech out there, but unfortunately deploying it is a really key and important step in engagement too. And so our objectives today are to define digital mental health for you all, how we think about it, increase your understanding about how technology can improve mental health and well-being, identify current applications of digital mental health. We're going to talk about this broadly, but if at any point you're really interested in specific types of digital mental health, please reach out to us. And then identify just a few frameworks to get started. And so if you're joining this call today, most likely you are in the mental health field. And so I won't belabor this, but we know that there's a crisis, especially after the pandemic. A lot of different groups are suffering right now, and mental health is an area that needs innovation. This is an area that's often lagged behind in innovation. And so our team is really excited and motivated to help bring digital mental health to a lot of different organizations that maybe previously haven't used technology, or prior to COVID hadn't used technology. And so how do you expand and build on the skills that your teams have already learned? Or if you're a company, how do you bring your technology into different settings? And then in the next slide, this is a snapshot of a survey that was done in 2022 by CBS. And as you can see, mental health concerns are increasing. Again, we don't need to belabor it. Most of us on this call know this, but especially for groups, underserved populations, LGBTQA+, Black Americans, and also young individuals, so 18 to 34. This is a huge area of concern, especially in terms of how do we access resources, how do individuals access resources, how do we improve mental health overall. And I think also keeping in mind that this is not just when people are in crisis, but how can we leverage these tools for various areas.
Sorry, some difficulty transitioning slides there. So given what we know about the increased demand in different groups in particular that are showing spikes in demand for mental health care, we want to think about solutions, right? So one solution would be prevention and seeing what we can do on that end to help individuals maintain wellness and stay out of the kind of crisis end or more severe end where they might need to utilize services. Another area of solution would be workforce extension, so meaning increase the number of mental health professionals that are providing treatment so that they can help meet the increased demand. And then a final solution would be technology. And so that, not surprisingly, is our focus for today. Technology can be leveraged in a lot of ways, which we'll talk about specifically to help meet this demand. And so, importantly, when we talk about technology as a solution, we want to know how people feel about it. And there actually is evidence that people are willing to use technology to help support their mental health and their wellness. So from, again, the snapshot of a survey, you can see that 56% of individuals said that they would engage in mental health discussions, and 58% of individuals said they would use digital tools, including telemedicine, but we'll also talk beyond telemedicine today. So I guess the take-home message from this is, along with the increased exacerbation of symptoms and increased number of individuals experiencing clinical symptoms, people are actually now open to talking about it and open to using technology as part of that solution to address their symptoms and their wellness.
Chloe, sorry.
No, you're good. So how can technology help with mental health is the question then, given that we know people are open to using it. So this is a quote that we often refer back to because it speaks to the power that technology can have. So not is it necessarily, in some cases, can be very ancillary support and kind of on the sidelines. But technology is powerful in a lot of different ways that are very corely and directly related to mental health interventions. So digital health tools can connect people to others, to their peers, to providers, can empower people and teach people tools to manage their own health and wellness. And so there's a lot of different ways that technology can actually be leveraged. And if we do so in a strategic manner, then technology has the potential to transform how mental health care is delivered. And so then what do we mean when we talk about digital mental health, right? Most people are familiar with telehealth and appointments being moved to virtual settings, but we also mean this much more broadly than telehealth. So telemedicine definitely is included in that, but we're also talking about wearables and devices that can measure, heart rate and physical activity. We're talking about virtual reality, peer support tools, robots, and we'll talk through specific applications of these forms of digital health later on in our presentation. But also including gaming, which can have impacts on people's well-being as well, and big data and AI. And so all of these things will be a part of, we'll talk about how they're applied, but really the slide is designed to help highlight just how broad the definition of digital mental health is and all of the various ways that digital tools can be relevant to mental health and wellness.
And as I mentioned earlier, we want to think about this broadly in terms of digital mental health. A lot of us, especially in the clinical field, and I think we will speak to a few things that are specific to clinical use cases today. But thinking about this more broadly, even if you're not a clinician, how can you leverage digital mental health for your own well-being, for other people that you work with or know? And so thinking about it from a various entry points. And so there's a way that you can leverage digital mental health for prevention, such as improving early detection, early psychoeducation around what is mental health, right? A lot of times folks don't realize that they're suffering until they're in crisis. And so being able to leverage technology as a tool to learn more about mental health, to engage more in your well-being and healthcare generally can be an effective way to improve outcomes. Treatment-wise, increase accessibility and decrease stigma, and we'll talk about that kind of in more detail in a second. Recovery, so once you have gone through treatment and you are starting to feel better, or you are better, being able to continue to monitor and track how you're doing can be a really powerful way to help with prevention in the future. And then enhancing personalized treatments and approaches. So efficacy, we believe that digital mental health, especially when developed correctly and effectively, can be really powerful in making change and differences. And then as we've seen with COVID-19, a lot of us had to switch over, most of us had to switch over to digital tools. And so at this point, we've had a tipping point. Prior to COVID-19, a lot of providers, employers, and companies were more focused on in-person treatments and leveraging in-person connections. And now we've realized that technology can be successfully deployed and used as a way for individuals to engage with their mental health. And so on this slide, these are high-level benefits of digital mental health, and this was the World Economic Forum put this slide together. I think it's hard to summarize all of this information. We work in a lot of different kind of areas in this space, but this provides a nice way of thinking about how digital mental health can help you, can help your employers, can help your organization, can help your company. And so bringing, starting at the top here, looking at novel research and treatment options, we can kind of think about the traditional model of going to therapy once a week for 50 minutes. And when you leave the therapy room, whether or not you engage in homework or any of those behaviors beyond that is always questionable. And so is 50 minutes a week the right model for you? And for some people, being able to engage in their mental health daily or at different frequencies, and again, that personalization aspect can be really powerful. And so using digital mental health as a way to engage in mental health outside of therapy, but also outside of that kind of more traditional model. Increased accessibility, availability, affordability, and scalability. This is really important, especially given our workforce shortage. There aren't enough therapists out there. If you yourself are a therapist, you most likely have received emails about different clinics and or teletherapy companies looking to engage with you and bring you into their platform because there is a shortage right now. And so even though teletherapy is a very powerful tool, we have to think outside of that and how can we leverage digital mental health even more broadly. As Chloe was pointing out earlier, there's a lot more to digital mental health than just teletherapy platforms. Greater satisfaction through consumer empowerment. So being able to allow people to choose the things that work for them can be a really powerful tool. We've already talked about clinical efficacy. That's a really important aspect to this. So leveraging existing therapies to develop these tools so that they are based in research and have foundations that are effective. Precision and personalization. I think a big one is also the decrease in stigma, especially for rural populations or for underserved populations. There can be a lot of stigma about reaching out for mental health, and so digital mental health tools can help individuals kind of enter where they're ready, kind of their stage of change. And then data-driven and outcome-focused decision-making is really important. And so not just are you engaging with digital mental health tools, but that technology itself can be leveraged to understand how people are engaging with tools and enhancing and improving outcomes, but also giving data back to the individual to help them understand their own mental health. We know tracking your own mood in and of itself can be really powerful. Again, promoting equitable access, being able to leverage these tools to reach different populations, adapting the tools and developing the tools with individuals with lived experience can be really powerful in being able to reach a lot of individuals that maybe in the past wouldn't have engaged in mental health resources. Focusing on prevention and early treatment, again, before you're in crisis, using these tools to be able to learn more about your own well-being. Integrating into healthcare systems, this is a big one, and also one that's in progress, right? We know that this is an area that is much needed. If any of you have been following recent developments with digital therapeutics, we know that this is essential. And given how much consumers and individuals are engaging with digital mental health, we will get there. It's just a matter of how and when. Needs-based services, really understanding what individuals need versus just one size fits all. Improving population data, again, being able to look at larger populations, understanding how they're engaging with mental health and building upon that, and enabling self-determination. So I know that was a lot of information, but I think it's really important to understand all the different kind of aspects of digital mental health that you can engage with individuals. And a lot of these things that we just discussed too are ways to kind of meet people where they're at and talk to them about digital mental health to help ensure buy-in.
There we go. I'm not sure what's going on with the slides today. So ways that technology can be leveraged. So given that we've discussed kind of all of these applications in terms of ways that technology can be used to benefit mental health and wellness interventions. Now we'll actually talk about specific areas of application based on the type of intervention. So this table is designed to convey a lot of information just in a snapshot. So to walk you all through this, on the application column are different types of wellness and or clinical interventions that individuals can engage in. And then the rest of the columns are different forms of digital mental health. And so you can see that there's a lot of different types of digital mental health across a lot of different types of wellness and clinical interventions. So mobile apps have a lot of versatility and do a lot of the types of intervention, everything from behavioral activation and helping individuals schedule activities that are promoting their well-being or helping connection with others, mood tracking, mindfulness, social connections such as peer support apps, skills training within the app itself, and then tracking physical activity like footsteps or things like that. Wearables, devices like watches or headsets or any sort of monitoring device that you wear on your physical body can help with mindfulness and breathing or tracking other forms of physical activity, such as heart rate or blood oxygen level and that sort of thing to measure more physical wellness and how that may impact or interact with stress or other forms of mental wellness. Peer support can help with social connection. And then, there's a lot of research out there exploring other benefits to peer support interventions as well. And then virtual reality or augmented reality can help, applications can help with behavioral activation like Pokemon Go and getting people out and moving and engaging in activities. Mindfulness, it can be done through VR and creating a 360-degree immersive environments to help facilitate mindfulness. Social connection, so platforms where people create avatars and can get on and connect within the virtual environment. Exposure therapy is another big area for virtual reality where a lot of research and a lot of different types of programs exist out there where people's trauma can be created in a virtual environment, and then a therapist can help facilitate exposure to that environment. And then skills training, things as basic as like social skills or learning how to interact with different components of the world, like going into a grocery store. There's lots of different platforms that will help with basic skills training as well. Robots can help with social connection and skills training. There's been some research specifically in the area of autism with robots that is pretty interesting. AI can help with mood tracking. So a lot of systems now can do more passive data collection and track what users are doing on their phone, for example, and make inferences about mood based on physical activity that's gathered by the smartphone or engagement with other platforms that would be indicative of mood. And then video games can help individuals with social connection or helping to build skills. And the cool thing about this is there's actually research out there for all of these areas in different contexts. And so this list may not be exhaustive. In fact, it probably is not exhaustive, but just designed to give you a snapshot of all of the different ways that digital mental health can be relevant to all of these different areas of wellness and mental health interventions.
Okay, so there's a lot of options out there, and we all know this. If you look at your phone, if we would have you all on video right now and ask you to raise your hand and then never used it and or used it once, because we know there's a lot of technology out there. There is a key component we mentioned earlier around implementation, which includes engagement and kind of acceptability and feasibility of using a technology. And so with that, there are some tools that you can use and some frameworks that exist around understanding what technology is the best fit for you. Because we know there's over 10,000 apps, mobile apps alone, and that's only just one of the columns of what Chloe just gave an overview of digital health. It's a little hard to know where we start. So there are three kind of options that I'm going to talk through here. So the first being, Chloe, if you could advance the next slide. The first being One Mind CyberGuide. So this was originated out of Northwestern, is a tool for assessing mobile apps. And so this was developed by psychologists in a way that understands both transparency. We haven't touched on this today, and it's a whole nother talk in and of itself around ethics and privacy of data. But this is an important area, important to take into account when you're looking into apps. So One Mind CyberGuide has several different kind of buckets that they look at in terms of what a mobile app does, how effective it is, and then giving it an overall score. This provides a more fine-tuned assessment of digital mental health beyond just the App Store. And so it provides additional layers to look at in terms of engagement and design. Similarly, Mind Apps was developed by psychiatrists to look at mobile apps again. And so this provides a framework too. There's been a lot of research done on both of these in terms of how it can help you determine which tools would be best for you. So for instance, you can go to these websites that we put up here, and they allow you to search by what type of tool you're looking for, what condition you want to treat and or want help with, those types of things. And then our VXVY evaluated tool technology, which we refer to fondly as the VET. This is a proprietary internal database that we've developed, and how it differs from the prior two tools is that it looks at digital mental health more broadly. So as I mentioned, One Mind CyberGuide and Mind Apps just looks at that mobile apps space, that one column in the table that Chloe shared. However, we look across all of the different digital mental health technologies that are out there. And I didn't mention this earlier, but we have a previous webinar on our website, and we'll share the link here. But if you're interested in learning more about what we do, we have written a white paper around the VET and kind of what the components are of that, taking into account different frameworks that have already been developed. But feel free to reach out to us if you have any questions about kind of where to start for you or your organization.
All right, so we are at that point where we reached the summary. So just to kind of recap some of the main points that we made. Access to evidence-based mental health services is limited. This is something we're all familiar with. Because of the current demand increasing. But technology does have the power to augment very many different areas of mental health, from prevention all the way through recovery. Technology can be relevant at all of those steps. And then finally, there are many different applications of digital mental health. And so we recommend spending time vetting the tools prior to use. And then also just would want to note that there is a learning curve also with implementation often. And so finding ways to not only identify a tool that's going to be a good match with your needs and that you feel like has evidence-based high quality content and is a great match for what you're looking for, but then also that step of when you roll out the digital mental health, helping users engage with it in a way that feels useful and that feels sticky, so that they continue using it beyond the first day or beyond the first week or month, so that it can be a sustained solution and something that potentially has room for scaling over time. So there's a lot of nuances to that, and some of that vetting process can help with that as well. So thank you so much for listening to our talk today. We have provided our email addresses, so this is direct formats for contacting us. You can also go to the website to learn more about what we do and the work that we're involved in. And then there's a people page on our website that gives you links to the rest of our team, to which you can also get emails there. So please don't hesitate to reach out if you have questions about this presentation specifically, or more broadly about what we do, or if you have your own questions about how you're using digital mental health, we would love to engage with you. So again, thank you so much for attending today.